Hello, everyone. It is Wednesday, December 16th. Welcome to another episode of Together San Diego. I'm Luis Cruz, Community Relations Director at the San Diego Union-Tribune. Joining me this afternoon is Dr. Ross Colt, Medical Director at Gary and Mary West PACE. Dr. Colt is going to talk to us about how you can make a difference without even leaving your car this holiday season. Dr. Colt, thank you very much for joining me today.
Thank you very much for having me, Luis.
Oh, it's my pleasure. First, tell us about West PACE and who you serve.
Yeah. So West PACE is a program of all-inclusive care for the elderly. So we have a team of compassionate professionals that are dedicated to trying to keep our vulnerable seniors living at home for as long as safely and humanly possible. So we care for people that are over the age of 55 that have some chronic medical conditions that make it challenging for them to be independent at home. They might even qualify for a skilled nursing facility. They may need help with bathing, help with dressing, help with their medication management, for example. And we provide a team-based approach to allow them to live at home. Our main goal is to keep them out of unnecessary emergency room visits to avoid unnecessary hospitalizations. And on our team, we have medical providers, we have social workers, physical therapy, occupational therapy, transportation, nursing, recreational therapy, and a dietitian. So it's this team-based approach, all dedicated to allowing our fragile and vulnerable seniors to live at home for as long as safely possible.
And how long have you been around? Talk about the legacy also of Gary and Mary West, the founders of West PACE.
Yeah, no, that's a very good question. So the concept of PACE is not new. It's been around for nearly 50 years. It started out originally in the Bay Area, a little clinic called Unlock that had one dream. They said, we want to allow these vulnerable seniors to live at home for as long as that's safely and humanly possible. And that vision has not changed over the past 50 years. And that concept has spread over our nation to have more and more PACE centers dedicated to allowing seniors to age in place. Now, Gary and Mary West are our benefactors, and they are compassionate philanthropists. And they had a dream. They said, we know there are a lot of seniors in the San Diego area that are really falling between the cracks in our complicated healthcare system. Surely there is a way that we can provide a way to navigate this system for our vulnerable seniors. And so they came upon the concept of PACE. And through their philanthropic gifts, they have created Gary and Mary West PACE. And our team has now been serving the seniors of North County area since September of 2019. We are a rapidly growing organization, but there's still so many more that could be served in our community.
Speaking of serving, West PACE is hosting a drive-through collection event on Tuesday, December 22nd from 7:30 to 10 in the morning at your center in San Marcos. Talk a little bit about that.
Yeah, thank you for bringing that up, Louise. So all month we've been accepting gifts for these seniors and necessities of life. So for many of our seniors, they have very limited financial benefits. So that they come down to a decision. Should I buy shampoo, razors, combs, brushes, toiletry supplies, or should I buy food? So in this Christmas season, we'd like to help make that choice for them by providing them with some of these everyday necessities. So on the 22nd, you will have your opportunity to help serve the community and serve these precious seniors by bringing your gift of unused toiletries, shampoo, razors, socks, or maybe even a gift, something to put a smile on a senior's face, a small puzzle maybe, a small wrapped gift. All of these items should be new and unused, but our goal is to put together about 200 bundles of household necessities, the toiletries that I've mentioned, as well as some small gifts, just to bring a little bit of light this Christmas season into these seniors' lives.
Now, for people that may be watching but may not be able to drive to this event on the 22nd, what are some other ways that they can help?
Yeah, you bring up an excellent idea, Louise. We also have a GoFundMe site on our website, which you can find at www.westpace.org. So on that GoFundMe site, maybe you're in a busy schedule, or maybe you are sequestered at home, but you really want to help the seniors in our community. You can go to that website, that GoFundMe site at westpace.org, and make a donation. Our goal is, during this month of December, we want to try to raise $5,000 to help these fragile but very precious, vulnerable seniors. And I think with our North County community, we can achieve that goal.
Great. I put the, let's see, we have the westpace.org. That's the website where people can find the GoFundMe account. It's also in the different, we're streaming live on our Facebook and YouTube and Twitter pages, so people can find the link there as well. Talk a little bit about how COVID-19 has affected your work.
Yes, that's an excellent question, Louise. COVID-19 has really ravaged our planet, and it's greatly changed the way that we have provided care to our vulnerable seniors. We had to, back in March, when the pandemic was originally striking our community, we had to very quickly and nimbly adjust our care. So instead of bringing everybody to our beautiful center here in San Marcos, we had to now bring the care to them. We had to reach out into the homes to provide telemedicine, for example, to provide home visits, to provide care remotely in the home, to help with some of the things that you and I might take for granted. Some of the things like bathing, preparing food, or taking care of your medications. A lot of our seniors need help with that. So with the pandemic, we very rapidly shifted to do a lot more virtual medicine, whether that be through video visits, whether that be through telephone calls, or whether that being from our compassionate and caring staff going right out into the participant's home to provide that care where they live.
How do you suggest caregivers or family members have those delicate conversations with their loved ones about taking additional steps to seek medical attention and assistance?
Yes, an excellent question. You know, during the holiday season, this is a very challenging time. I think all of us are used to the dreams of sugar plums dancing in our heads. But for many of our seniors, this is a very difficult time. There's a lot of challenges with depression, a lot of loneliness, a lot of isolation as people try to protect themselves from the pandemic. And you may be a caregiver that is trying to provide care for these vulnerable seniors. You may have a loved one that you are serving and providing that care for. You know, it is estimated that up to 1 in 5 of adults in our country are providing care for another family member or loved one that is over the age of 18. So this is a very common situation, and it can be very challenging. What I would encourage all our caregivers to do is also take care of yourself. Be on the lookout for signs of burnout. Maybe you find that you're not sleeping as well as you used to. Maybe you're finding that you're having a hard time concentrating. You really just can't focus on the things you need to get to in order to get done. Maybe your appetite has increased, or maybe it's decreased. You know, there's an old saying that you cannot pour from an empty cup. And so you really need to take care of yourself and know when to reach out for help. Maybe your loved one would be an excellent candidate for PACE. We provide a lot of these services that you are providing: care in the home, assistance with some of the activities of daily living, with bathing, with shopping sometimes, with medication management. We are there to provide care for your loved ones, and we can take some of that burden off you and be a shared partnership in caring for the people that you love the most.
And Dr. Colt, what are some other tips you may have for caregivers who are maybe, you know, I guess could be feeling a little burnt out at this point, as you mentioned?
Yes. Again, during the holiday season, our societal impression is that everything is happy, everything is snow and light and sparkles and presents. So be aware of your own mental health. Get outside if you can, wearing a mask, and go for a walk in your neighborhood. We have to follow our community regulations, but they do allow you to go outside for purposes of exercise. Consider reaching out to other friends or family members virtually. This is a wonderful holiday season to spend at home and virtually reach out to your loved ones or to your friends. Do a Zoom call, do a FaceTime call. Stay connected with the ones that you love. Seek out other ways that you can get your cup refilled, but do it virtually. Keep yourself safe at home and reach out to get that support that you need, but do it in a safe way. This is a great time for a virtual Christmas.
Right. I should also mention that you are a decorated war veteran who served 2 combat tours in Iraq and retired after 24 years as Army Colonel. Tell us a little bit about your career path and how it led you to this role as the medical director of the Gary and Mary West PACE.
Yes, thank you, Louise. Now, we do tread into dangerous grounds, of course, when you admit the fact that I am a retired Army Colonel and I'm living in the land of Navy and Marines. So this is a delicate path that I walk here. No, I would say it is an honor to serve. I served my country for nearly a quarter century, and now I'm serving in another way. And it is truly an honor to serve. I think that as an Army physician, I worked for many years in an inpatient hospital. I had the honor and the pleasure of taking care of many geriatric patients, and now build on a wealth of experience to provide that compassionate care to the seniors in North County. So yeah, it's really a blessing for me to be able to continue that service that I discovered so long ago.
That's great. It's awesome to see everything that you're doing to help our community. Again, we should mention that West PACE is collecting items until the end of the year, and they are holding a special drive-up donation event on December 22nd from 7:30 to 10 in the morning. And here's some more information about that. I put some information also in the chat box, in the different social media platforms, on the comment section. And also, you'll notice on the lower left-hand corner, there is a QR code. You put your phone up to that, you can get more information on the GoFundMe account that the PACE Center has also set up. Dr. Colt, did I miss anything? Anything you'd like to add?
Louise, I think you covered it all very well. Again, I would just remind people that the number of seniors that would benefit from a service like PACE is huge in our community. The need is great. And so if you do know a senior that would benefit from just a little bit of help at home, that might benefit from PACE services, please reach out to us. Again, westpace.org is our website. We have an entire team of compassionate professionals that are standing by to help provide care for your loved ones. And maybe I'm talking to you right now. If you are a senior citizen that is having a hard time taking care of your medical needs, your health needs, we are standing by to help. And with that, I would wish everybody happy holidays and God bless from Gary and Mary West PACE.
Thank you so much, Dr. Colt, Medical Director at Gary and Mary West PACE. Happy holidays to you.
All right. Thank you, Luis.
And thank you at home for watching, everybody. Have a great day.
News is more important today than ever before.
I'm currently outside Otay Mesa Detention Center.
I'm about to get a report at Sharp.
Out at Sunset Cliffs.
COVID testing site.
We live for these times when we're able to bring the news into the homes of people who need it the most.
I thank all of you for supporting our work.
When you subscribe to the paper, you're telling us that you believe in what we do.